Good afternoon, everybody. I trust you can see my slides and hear me.
Yes, we can. Thanks.
Perfect. All right. Well, thank you for inviting me today. Luch already introduced the topic, so we're going to talk about exercise today. And I'm going to jump right to my summary right away, so you can fall asleep or do whatever you need to after this. But I'm going to give you a summary in 2 slides. First, everybody, including people with Marfan syndrome, benefits from exercise. This is directly from the marfan.org website, and they have a very nice summary or PDF article on all physical activity guidelines. So exercise does benefit. It benefits people's moods, your long-term well-being. It also helps reduce other cardiovascular risk factors, coronary artery disease, hypertension, diabetes. So exercise is good. Then the question becomes, what is safest exercising? So in general, to make it simple, safest exercising involves non-collision activities, non-competitive, and then non-strenuous. And we often use a marker, a thumbnail kind of representation of that is when you're doing exercise or activities, you're able to talk in a conversational tone. For my outline, I will go over what are the concerns that we have with exercise, what you should know about exercise classifications, what are the safest ways to exercise, and then does exercise have benefits? Please recognize these limitations. I'm providing general guidelines, primarily focused on the cardiovascular system prior to aortic surgery. Please discuss your specific recommendations with your care team, including your eye and spine specialists. So first, we'll talk about what are the concerns with exercise. So there are primarily 2 main risk factors with exercise that we worry about. First, when you exercise, your blood pressure greatly increases during exercise, and that puts extra stress on the aortic wall. And second, hard collisions can cause trauma to at-risk organs. This slide shows a summary of the different events that we worry about with exercise. So when you put extra stress on the aorta from the high blood pressure during exercise, you could get an acute aortic dissection. Perhaps you cause the aorta to dilate faster. For eyes, you can get a retinal detachment, especially if you have a trauma to the head. You can get lens dislocations. For your lungs, if you have especially a great, trauma or even like a great pressure change, like from scuba diving, you could get a pneumothorax, musculoskeletal, running constantly, pounding on your organs can cause damage or pain in your back, your feet, and your hips. And sometimes people have other heart problems. Perhaps you have a cardiomyopathy, valve disease, which could be worsened by exercise. And some people are going to be on anticoagulation if they've already had surgery, especially if they've had a valve replacement. So there's a risk of bleeding with trauma if you're on anticoagulation. So these are a summary of the things we worry about during exercise. Should be noted, however, that there's really only a few reports of people having aortic dissections during exercise. But I don't know if there's only a few reports because people with aortopathies likely limit their exercise. But certainly we don't see a ton or hear about a ton of people that are exercising within guidelines having an acute aortic dissection. Now I'm going to move on to what you should know about exercise classifications. There are some key classification terms that we will go over. You've probably heard us say these in clinic. First is the idea of static versus dynamic exercise. Then I'll talk about exercise intensity, risk of bodily collision, and then go over competitive sports. So again, first I'm going to go over static versus dynamic exercise. So static is also known as isometric exercise, and dynamic is also known as isokinetic or moving. All right, so with static exercise, muscle contraction is sustained. right? You're kind of flexing your muscles the whole time. With dynamic or moving exercise, your muscles are contracting and releasing typically. So some examples of static exercise would be weightlifting, especially heavy weightlifting. An example of dynamic exercise would be running. And it's important to understand these differences because they affect blood pressure differently. So typically static exercise, again, the weightlifting more, the constant constricted muscles causes a greater increase in blood pressure during exercise than dynamic exercise. As you probably already figure or know, most exercises have a combination of both static and dynamic exercise. So there's not one that's just one or the other. Next, I'm going to talk about exercise intensity. So you will read about this in the literature, or maybe sometimes hear us talk about this as a metabolic equivalent of task, or METs. Basically, one MET is the energy spent while seated at rest. So what I'm doing right now. And we classified various exercises depending on their METs into light exercise, moderate, or vigorous. And you can see this breakdown of different examples of light, moderate, and vigorous exercise. In general, anything less than 6 METs is considered moderate or light, and greater than 6 METs is considered vigorous. So let me provide some examples. So walking leisurely is considered light exercise. Swimming recreational light is considered moderate exercise, but swimming fast would be considered vigorous. Shoveling, snow shoveling, I don't know if we have anyone from Minnesota or up in the mountains here that have to do a lot of snow shoveling, that can be very vigorous. Hiking up steep grades, that can all be more vigorous exercise. And again, in general, we encourage people to exercise at less than 6 METs, which is roughly indicated by being able to have a conversation during exercise, kind of what I talked about earlier in my beginning summary slides. Now, my top of my slide is blocked. I'm sorry when I'm looking at this. I think this is about competitive sports. So what are the worries, especially about competitive sports? So in competitive sports, they tend to be higher intensity. So you're at a lot higher in the MET scale that I just spoke about. There's also a lot of pressure to stay in the game. So you don't want to let your teammates down. So you may be feeling really tired, exhausted, but you don't limit yourself as much because you feel an obligation to perform for the team or maybe make that personal best. So again, competitive sports can get you into problems. Now I'll talk a little bit about contact sports, so or bodily collision sports. So a lot of times we think about that as just being contact sports, like football is a classic example, hockey, another example. But a lot of activities that aren't necessarily contact can also have a risk for bodily collision, especially as kids move from elementary school to senior high. So you can see soccer here. I don't know how many soccer fans are out there, but little kid soccer, not very intense, and collisions are not very hard. But as people get older, there is a pretty big risk for collision with that. So the American Heart Association has classifications for competitive exercises. And how they break these down is basically by the increasing static component. So remember, that's like the weightlifting component, and dynamic component. And they break it down into low static, low dynamic, moderate dynamic, high dynamic, and then moderate static and high static. And again, these are more for competitive sports, but we have this breakdown. I'm not going to go in through all of these examples, but you can see activities that are low dynamic, low static are like golf, bowling, And activities that are high static, high dynamic are things like canoeing. This is competitive canoeing, cycling, competitive cycling, rowing, competitive rowing. So those are kind of combined both elements. So now I'm going to talk about what are the safest ways to exercise. And before we get into some more specifics, I just want you to realize that this is really a shared decision process. So these are discussions that you should have with your provider, and we will come to an idea or kind of a shared decision on what is recommended. This is all preface that people are getting at least yearly aortic screening, maybe more often, depending on their degree of aortic dilation, but absolutely need to get that screening so we can understand the risk. And I always really want people to wear a medical alert bracelet, because if something happens, we want to make sure that someone that any healthcare provider or EMT will know about the Marfan syndrome or other connective tissue disorder, it can take appropriate action. So these are the background information for safest exercising. So again, I come back to my slide from earlier that the safest exercise is activities that are non-collision, generally non-competitive, and non-strenuous. So again, able to talk in a conversational tone while doing the activity, which generally is less than 6 METs. Some examples of recreational activities that are non-strenuous would be walking, leisure jogging, and leisure biking. Things to avoid are intense static exercise that leads to muscle fatigue or straining, kind of the grunting when you're weightlifting. Again, contact collision sports, rapid changes in atmospheric pressure. So this would be things like scuba diving, and that's more of the risk for a pneumothorax. And coming back to intensity, exercising to exhaustion or testing your exercise limits. Some modifying factors that your provider may use to recommend or discourage different activities could be a specific genetic condition. So maybe with vascular EDS, we may be a little bit more cautious than someone with Marfan syndrome. The aortic diameter certainly impacts how we would counsel someone on exercise. So if there's significant aortic dilation, we would want less intense activities than if the aorta is normal. Age certainly figures into this. I talked a little bit about that with collision sports and talking about soccer. Younger kids, elementary school kids, they can participate in sports, but they don't tend to be so intense in their activities, and their collisions are a lot less forceful than high school kids doing soccer, playing basketball. And if there's a family history of early aortic problems, especially if it's at a smaller aortic size than we would expect for that genetic condition, would probably make us a little bit more cautious in our recommendations. So I come back to this slide on competitive sports. So I said, in general, avoid competitive sports, but some are allowed. So if you're interested in competitive sports, you want to steer your children to participate in competitive sports, one of the better ones would be golf. I don't know if there's many competitive bowling leagues now. Cricket, that's one that I don't often think about, but obviously that's a very popular sport. So these would be ones that we would typically not have to limit, even if you wanted to do it competitively. Now, again, aortic size may play into that a little bit, but that's general guidelines. And then this slide shows recreational non-competitive sports and exercise for Marfan syndrome and related disorders. And again, this is in the absence of significant aortic dilation. So, and a lot of these overlap. So again, bowling, golf, permitted, brisk walking, modest hiking, archery, table tennis, light weightlifting with repetitions, these are generally considered okay. The things that we would strongly discourage, again, bodybuilding, ice hockey, rock climbing. Rock climbing, if you're really going hard, has a lot of static component because you're really supporting your body weight. It's a very strenuous workout for your muscles. And then things that are intermediate, which would probably be affected more by your aortic root size, would be like singles tennis, again, recreational, more than modest hiking, ice skating, things like that. Now I'm going to talk about, does exercise have benefits? This is a pretty easy question, but exercise for everybody reduces your cardiovascular risk factors for things like coronary artery disease, diabetes, hypertension. So just like for everybody in the entire population, exercise is good for reducing these problems that oftentimes can come up, maybe not something that I deal with as a pediatric cardiologist, but certainly as people transition to adult congenital heart disease, get to middle age and beyond. So it's good to reduce those factors. And we all know that some amount of exercise certainly improves our mood and emotional well-being. Does exercise actually benefit the aorta? Well, it's nice of Dr. Sakai to introduce the Marfan mouse models. And this was a study done in 2017 that looked at one of these preclinical mouse models of Marfan syndrome and looked at having the mice go through a period, I think it was 4 months of moderate dynamic exercise. And so this figure over here and the top on A shows the aortic diameter at age 4 months. This is before starting exercise. In this figure, WT stands for wild type, so that would be the mice without the genetic change for Marfan syndrome. And then the Marfan mice would be the mice that do have. They're the transgenic mice that Dr. Sakai spoke about. So this is before they started, and you can see that the mice that had the Marfan syndrome change had a larger aorta at age 4 months. And then they exercise them, and this is actually a mouse echocardiogram. And I'm not sure how big your slides are, but with these mouse echocardiograms, you can actually measure the aortic sinus of Valsalva. And so they looked at, again, wild type mice, either that were sedentary, so not exercising, or exercising, and then the Marfan mice that were either sedentary or doing the moderate dynamic exercise for 5 months. So this is 5 months later. And if you look at both, so go up to C, if you look at the rate of aortic dilation, exercise didn't affect the wild type mice at all. But in Marfan syndrome mice, their dilation rate seemed to slow down with moderate exercise. And when they looked at the diameter of the aortic sinus of Valsalva, it was actually lower in the mice that had moderate dynamic exercise. So this would suggest that perhaps exercise, to some degree, this is only to a moderate level, not intense exercise, but regular moderate exercise may be beneficial in protecting the aorta. Now I'm going to wrap up and do my summary, but now I'm going to add another slide. So summary in 3 slides. So I come back to my original point that everyone, including people with Marfan syndrome, benefits from exercise. And we highly encourage it, regular exercise. The safest exercise, again, is non-collision, non-competitive, and non-strenuous, which means able to talk in a conversational tone. For future directions, it may be that regular exercise, regular moderate degree of exercise may slow the rate of aortic dilation, but stay tuned because this is in the preclinical mouse model, and we don't know that that's going to stay tuned or stay true for humans, but certainly there are a lot of other benefits for exercise. So I'll wrap up my talk there and open it up for questions, and just know that the marfan.org website has a very good PDF resource in their resource library on physical activity guidelines, which goes over what I've gone over today, and it can be a resource for you to check when you have questions. Thank you.
Well, thank you so much, and thanks for the commercial. We always appreciate that. But that's what it's there for. It's for everybody to refer to. But I already know as I open up the Q&A box that people are going to know specifics about specific exercises in particular sports. So I think it gives you a chance to reiterate what you said before about moderation and levels. So we've got questions here about yoga and pickleball and what else people want to know about. Weight training. Can you want to make a comment about those kind of activities again, please?
Yeah, so I think I confess I don't know the different types of yoga, but I know on the resource page that they mentioned a type of yoga that seemed to be very good and recommended, and I don't know the type. I mean, I think in general, yoga is probably okay, as long as it's not providing a lot of extra stress on your joints. Probably not hot yoga, I think, may not be a great idea, but I think in general, yoga can be done. There might be various types that are less appropriate, which I don't know. But again, I think if you're doing something that's not causing your joints to hurt, that you can do the yoga and you're able to talk to the person next to you, should be okay.
Great. What about pickleball, the latest craze?
That's a great question. So again, I think all of this, you have to consider, again, are you doing competitively, non-competitively? Are you just going out to, have fun? Pickleball, I would say, would be in the kind of tennis category. Maybe the exertion is a little bit less because it's a smaller space. So I think in general, it should be okay. But again, you don't want to push yourself so you're panting and you're breathing really hard. So I think in general, it should be okay. Also, again, I'm oftentimes maybe too focused on the heart, but just make sure that you have good shoes and things that you're not bothering your feet or your knees or other joint, your back. So make sure that that's okay. But I think in general, pickleball would be okay.
I just want to put out one shout of watching out for collisions in pickleball too, having watched a lot of that. So anyway.
So maybe more singles than doubles.
Yeah. So you talked a little bit about being a little more cautious in VEDS. So one person has a question about what is safe for untested children suspected of having VEDS, and how should a VEDS parent handle at-risk kids who desire to play team sports?
I think I'd be curious to hear what other providers on the phone or in this meeting would say. I think with VEDS, with vascular EDS syndrome, we're very, very cautious because we just can't. It's harder to predict when someone is at risk for events. Like with Marfan syndrome, we do have a little bit of, the aorta is not dilated. That makes us feel a little bit safer. The aorta is really dilated. That makes us feel less comfortable. So we can kind of put some gradation, I guess, in our recommendations. With VEDS, with a normal, head to pelvis exam, the MR angiograms, I still don't know that we feel super comfortable that means that there's, no risk with an event. So team sports and someone that was suspected to have VEDS, I guess I would not recommend that.
And again, talk to your provider on your situation.
Yeah.
What about a target heart rate to stay below during exercise, or is it solely based on perceived exertion?
Well, so that's a good question. So, I mean, a lot of times now people have Apple Watches or Fitbits that track your heart rate. I think in general, we say try to keep it less than a 30% change from resting heart rate, somewhere in that range. So you could do it that way. I think, but I also think, just relying on, having a conversational tone is also okay. We haven't really done studies and said, let me take a step back. These are all rough markers for exertion levels, and no study has looked at, if I exercise and I can't talk, how unsafe is that, or what's my risk, or if my heart rate goes up 50%. So these are all just thumbnail kind of guidelines or markers. We shouldn't get so specific on the exact heart rate, but in general, if it's maybe about a 30% increase, less than a 30% increase is, I think, generally considered okay.
Okay. What about stress tests? Are they okay for someone who has an aortic aneurysm? And this particular person said they have an aneurysm that's 4.1.
A stress test, like going on the treadmill.
Yeah, I believe that's what they're talking about.
Yeah. I don't know how to answer that. So I think you would have to know the reason for doing the stress test. I don't think we would not do a stress test to see if it was safe for someone to do exercise with the 4.5 centimeter aorta. If they were looking for coronary artery disease or something else, your doctor may have a reason to say the benefit of this test is higher than the risk. In that situation, that would be okay. But we don't typically, say, hey, let's do an exercise test to see if you're safe, because it just doesn't work that way.
What about exercise in people who have already had aortic root replacement surgery? Are the recommendations the same?
Yeah, so that is something I didn't really get into, but I think if that's the case, that probably depends also on the rest of the vascular tree, right? Making sure that there's not other big aneurysms, other places, because that would change it. But I think, still doing, after the surgery, I'd probably be more in kind of the lower intensity, maybe, low, moderate intensity activities. So I think, walking is okay, like biking, but I just would not maybe quite push it as hard. I know that that's hard to tell, but again, I think, walking for fun, walking the dog would be great. Light bike riding, just not pushing yourself too hard.
Yeah, I think people want yes or no, and there's so much gray here.
There's a lot of gray.
Yeah. Yeah. Somebody, last question for you. Somebody says they're scared to jump and land too hard. Can you speak to an activity like box jumping? I don't know what that is. Box jumping, quick movements, AKA plyometrics, specifically regarding potential trauma to the body organs, as well as the stress on the vascular system. Is that something that you're familiar with?
So box jumping, I think of as part of HIIT training, like the high intensity interval training, I guess,
Okay.
which, that's going to be pretty high heart rate. It's going to get your blood pressure going. It's going to be pretty intense, right? And so I don't know that that's a great idea, to be honest. And then, it's hard for me to say what that's going to do to your joints. And so, I think that's something you have to talk to your orthopedist about. But, obviously, if you're doing something and it hurts, it's hurting your joints, probably not a great idea to do it, because you want to, preserve those joints long term.
All right, one more for you, because I like this question. This person is having PVCs or out of breath walking around the house. How can they keep it non-strenuous when, for example, walking around the neighborhood? Or should they see a doctor right away because they're out of breath already just walking around the house?
Yeah, that's a situation where I think you really need to talk to your provider. I don't want to, I don't know. Yeah, I don't know why what the cause for being out of breath is. Is it a lung issue? Is it heart failure? I think that's really one to discuss your provider. That may be a good opportunity for some cardiac rehab. There is, we don't have the opportunity to use that a lot, but something where some rehab is done to kind of work up endurance. And under a supervised condition, that would probably be a situation for that, but that's one where I really needs to be discussed with your provider.
Well, thank you so much for all the information. There is new information coming out all the time on this, and this is a really, really hard issue for people.